Hi guys, welcome back to my channel. I'm Alicia, and it has been a little over 2 months since my E-Day. I had 13 extractions and 10 mini implants placed with snap-in acrylic overdentures, and I did that all awake with novocaine, obviously, and nitrous, and some oral sedatives prior. So I was going to make a video today about my surgery experience and exactly how it went for me on surgery day. So there is a prior video that I showed a little bit from that day, like I was Snapchatting, and I put it together in a little like video. So if you want to look back at that, you could see that. But this, I'll just be talking about my surgical surgical experience as much as I remember, because if I keep putting this video off, I'm not going to remember most of it. So, all right. My surgery day was May 13th. The consultation for the surgery was about 4 weeks prior. So that's really not too much time, considering that the day of my consultation I was going in mostly because I had questions about the implants, about their cost, and if you can still get them done years later from having regular dentures or from having your teeth out, because I had been missing my lower back molars for about 8 years prior, and I was considering full dentures like ASAP. This year I decided I was going to fix my teeth one way or another. So I was considering full dentures, traditional dentures, and I wanted to know if the mini implants would be an option for the future and how much they would cost. So I really wasn't really expecting things to go the way they did. So on consultation day, a lot happened that day, and I know that now in hindsight, but at the time it felt like it went so fast, and I felt like there would be more time to like make changes to things. But just because it was such a fast process from like 4 weeks from consultation to surgery, it's just really fast. So I found it kind of hard to slow that down. But the only reason it matters is because they do ask you questions about your preferences for surgery, and I thought I would have time later, and I did try to, but I thought I'd be able to maybe make changes if I was really freaking out. But anyways, on consultation day, Dr. Shatkins told me if we had financing or if I committed to doing the surgery, that we would do impressions that day and be able to set a surgery day. So once they got us financing, my doctor does it right through his office, and it was a couple health lenders that only work with certain dentists. So it was something that my doctor did kind of for me. And once we got word that we were approved and that it was going to be for sure, he did x-rays. Actually, the x-rays I think were free. So I think the consultation, at my dentist, the consultation is free, and the x-rays I believe are free unless you have some sent from a previous dentist. So I didn't do that. I had them take new x-rays for me. And then once we got, he did the x-rays, came in and talked to me, said you're a great candidate. Looking at your teeth, I really don't like taking teeth from people that are very young. But knowing my history and everything I'd already been through, and the fact that all my upper teeth were already root canaled and crowned 8 years prior, one 3-piece bridge had decay above it and had to come out, and I already had an upper partial that would no longer fit if I took the bridge out, plus I only had 6 lower teeth left that were breaking one by one at the gum line. So anyway, he pretty much said, you're a great candidate, you're young, x-rays show that you don't have bone loss to worry about, and we could get you in soon, as soon as you want. So while they were doing impressions, he asked me about the color I wanted and showed me the little shade thing, but I think it was B1, but I was looking up, I wasn't looking in a mirror, so I could see the shade card but not against my skin or against my teeth. So he just said, you want them the same as the ones you have? And I said no, without trying to talk or move, because I had the impressions being done. So he said, okay, B, I think 1 or 2. He said, that's good, it's a bleach shade, bleach white. So after the impressions were done, that was pretty much it. And he said, okay, that's, everything's all set. We'll see you in about 4 weeks, May 13th. And I said, well, what color was that? And he said, well, don't worry. I don't want you to worry about anything. We've done this for so long. We know what you want. They'll be beautiful, white, perfect teeth. So I left that appointment excited. I have talked about this in other videos, but I was really excited and just mind blown that we were like even approved to have this done. So in my mind at the time, I just wasn't really believing it, that it was even happening. Like, it blew my mind. So it took a minute for that to sink in, and for me to realize that maybe there were some things I should ask about before I actually go do the surgery in 4 weeks. So I sent an email asking about the shade chosen and wanting to know about the gum color and how they determine the level of pinkness. and they responded and said not to worry about it. They sent me some before and afters of some other people because I requested that, and they said try not to compare the shapes, the whiteness, and the gums really, because you know everyone's unique and individual. It's customized for the patient, but just so I could see their work starting with and what they finished with. So that was helpful, and it calmed my mind. But I was still nervous because I didn't feel like I really picked everything myself, and I wasn't really, like, I wasn't involved in the shape of the teeth or types of smiles or anything like that. So I was just nervous. And also at the consultation, they briefly went over surgery and said that they can sedate people. It's $1,000 more because the anesthesiologist has to be there, and it is slightly cheaper not to need to be sedated. And I told him I have a lot of anxiety, like major anxiety problems, and I've never ever been able to go to an extraction and be awake. I tried it one time with one dentist who did nitrous, and the nitrous just didn't do anything. It wasn't until years later when I had root canals done with the nitrous that I realized how nitrous was supposed to work and how much it can help if it's done right. So I knew that it would work. And Dr. Shatkins, well, I also told him that all the other times, like when that nitrous incident went so horribly wrong and I could feel them ripping my teeth out even with the nitrous, I decided never again, I'll never be awake again to do extractions. So every other time that I would do it, I would be sedated, like the IV sedation. So when you're sedated with the IV, you're still breathing on your own, and they have to keep you breathing on your own. Like, so if you are hard to sedate for some reason, like it could be from other medications, it could just be the way you are. But in either case, and most times that I was sedated in the past, I woke up during my surgeries. So a dental surgery, I woke up in the middle, even though I was sedated with the IV, and I could hear the woman tell me, I was starting to yell and get loud, and she said, "Shh, be quiet. You don't want your kids to hear you, do you? You don't want to scare your kids, do you?" My kids were out in the waiting room with my mom. This was only a few months before this surgery that I had in May. So I woke up during that. It was extremely painful, and I started looking things up about sedation and why would someone wake up, and I guess you're still semi-conscious when you're sedated. So if they tell you like raise your left hand, or if they tell you don't move, or they tell you to get up or sit up, you'll still respond and listen to them. So you're not, I feel like, you know, you're not 100% in control of yourself, even though you're supposed to be sedated. But I also woke up during my breast augmentation, which was about a year ago, and I could feel them like packing things in. I could feel them stitching. I could feel the burning, but it felt like I was in a dream where you're trying to yell and open your mouth, but you can't make it, like almost sort of like a, I don't know, like a bad nightmare or sleep paralysis. But I felt like I couldn't open my eyes and I couldn't yell, but I could hear everything and I could feel everything. And I was trying to tell them, I need more like drugs, give me more drugs, because I can feel this and I'm aware of it. And then before I knew it, it was all muddled up and I was getting wrapped up and ready to leave. So I survived it. It was very difficult coming. It was a very hard crash after the sedation for the breast augmentation. Like emotionally, whatever they give you to wake you up, and the combination of it just made me an emotional wreck, and I was crying like the whole way to the hotel after to recover. But that only lasted about like 30 minutes. But anyways, knowing all these things and telling my dentist, Dr. Shatkins, about my previous experiences waking up with sedation, he told me he would rather keep me awake but comfortable. So he would give me nitrous, novocaine, and they do like a cocktail prior to surgery of a Benadryl, a painkiller, and an anxiety pill. So something like a Valium or Xanax for anxiety, Percocet or Vicodin for pain, and then a Benadryl. They said they would give it to you when you arrive. You have to come half an hour early. They give it to you then, and then you have half an hour until surgery. So it's supposed to help you start relaxing. And during consultation, I said, well, I don't know if I'll really need that. You know, as long as you know the nitrous is going to work, I should be okay, because I've had it done and done right, and I know that it's good shit when it works right. So he said, you know, okay, that's fine, you know, can decide later or whatever. And so the morning of surgery, I had just, you know, I had to get up really early, and I think you're not supposed to eat for like 12 hours prior. So I had very dry mouth, and I probably was hungry, but I wasn't really feeling hungry because I was so freaking nervous. And so my husband drove me out there, and we came in half an hour early. So I went in to check in, told them I was there, and she said, all right, go have a seat. So I went out and sat, and then like 10 minutes go by, and a nurse comes out to get me and says, okay, are you ready? You can come back with me. And I said, well, can my husband come? And she said, no, he doesn't need to. You'll be fine. And I said, well, just for the oral sedation, can he come back with me for that and wait till it works? She said, oh, no, you're only going to have like it says in here that you don't want it, actually. That's what she said. She's like, it says you're not getting the oral sedation. I said, but I called last week to make sure they knew, just because I remembered from consultation that I told them I might not want it. And then I changed my mind, so I made sure I called the week before surgery to say, can you make sure it says there that I definitely want it, and I will be there half an hour early to get it. And they said, yep, we'll make sure it's in there. So, come to find out, surgery day, that's not in there. So I said, you're going to have to make sure that they're going to give me that, because I don't think I can just walk in there without it. So she went and made sure. They came back out and gave me the oral sedation pills. I took them, and she said, well, it's only going to be like 5 minutes. So I said, all right. So really it was like 5 minutes later that I walked back to the surgery room with them. My husband waited out in the waiting room. And we went back by all the regular little booths where you can see people being worked on, like the regular exam places. And then we walked into this other big room. It had like a big metal door, and it was like straight out of the movies. I felt like just a surgery room that you just walk into. There's a table in the middle of it, and they tell me to sit down right away. I sat down, and I think I'm not sure if I still had my phone at that time or if I left my phone in my purse. I probably put it in my purse. I noticed that they have really cool music playing. It reminded me kind of like Led Zeppelin or something. It was nice. And the doctor was in a really good mood, made me feel pretty comfortable, and told me we were going to get started. And there was a lady anesthesiologist in there who was going to do the novocaine, I'm assuming. And I was pretty much okay up until this point. Like, I really wasn't freaking out. I was ready to get it done. My trust was fully in the doctor that he was going to keep me awake and comfortable. And I was able to go through with it just because of these other experiences I had where I felt like I was out of control. I felt like, okay, this time I really do want to be awake. I want to hear what people are saying, and I want to be awake enough so no one can doubt my memory, I guess. You know, I just wanted to make sure for myself that I was awake and comfortable too, so I wouldn't be further like traumatized from some of these experiences. So the nurse starts to do my shots, and one of them in particular just threw me over the edge. I think it was way up in the back, the upper, like way far back in your mouth, on the roof of your mouth. I feel like it goes straight to your nerves in your face or something. So I just had a reaction to that, like started hyperventilating. I started like rapidly tapping my legs, and she was trying to give me more, and I was just hyperventilating, and I already had the gas going, but I couldn't calm down, and it just made me, like, alarm bells were going off, making me think, oh my god, I can't do this. I'm not going to be able to handle it. If I can't handle the shots, I can't handle the surgery. Like, oh my god. Freaking out in my head. Tap, tap, tapping. They keep going. I swear there had to be, like, 20 shots. And so after a minute, you know, they'd have to stop and, like, try to let me calm down for a minute and then come back and do some more shots. And because you get a lot of shots, and they're very painful. That's probably the very worst part about this surgery was the shots. They have to give you a lot of them because you're getting all your teeth taken out from many different areas, and they're going to be putting the implants in, and some of them they're going right into the same extraction site, others they're not, but they're drilling them into your jawbone. So they give you a lot of novocaine. But it must be taking a little longer than expected, because Dr. Shatkins comes back in the room, and he's like, what's going on in here? And the anesthesiologist was like, well, we're trying to finish her novocaine, and having a hard time pretty much. And he's like, well, look at the tank, the nitrous tank. It's empty. She's hyperventilating, so she's not getting it. So he said, Alicia, I want you to just hold your breath, stop breathing for 20 seconds. Just give me 20 seconds. Don't breathe. I'll tell you when to breathe. So he counted 20 seconds. I was having a hard time hyperventilating and shaking and crying. You know, just a full-blown wreck. And so I held my breath for 20 seconds because I could tell that he was, you know, very sternly, directly telling me what to do. And I think before that happened, he said something like, Alicia, if you're hyperventilating, we can't do this. This isn't going to happen today. You can't be hyperventilating. And just the way he said it made me feel like I had responsibility for my own hyperventilating, because I knew that I wanted this done. I was there because I wanted to be. I did not want to let my freaking panic and hyperventilating make it so that I couldn't have it done. That was even scarier to me. So for whatever reason, I pulled myself together as much as I could, and I held my breath for 20 seconds, and when he was done counting, he said, take a nice, slow but deep breath through your nose and out your mouth, and just keep doing it. And after only a couple breaths, now I was getting the full effect of nitrous, and I was relaxed enough to let them finish the novocaine, which a few of them still hurt enough I was crying. And then the doctor came in and started poking around different spots and asking me if it hurt, and I said no, but I was freaking terrified, like, oh my god, what am I going to do if he slices into me and I can feel it? You know, like, that kind of stuff goes through your head. But I also was feeling very much like, I don't know if they were prepared for my level of anxiety, and I always worry that they're going to be pissed off that I'm so anxious and making them stop and go and stop, and, like, you know, I don't like having to do that. But the dentist started doing the extractions. My top 6 teeth in the front were cemented in bridges. A bridge is a 3-piece unit. There's no tooth in the middle. The teeth right here exist but are usually filed down to like nubs and then capped with a crown, but there's a crown attached here and to here, so the 3 of them were cemented in together for these teeth. So I had 6 of those. So the regular extractions he started doing, and I didn't feel it, and I couldn't freaking believe it. I did not feel the teeth come out. Like, I felt a little pulling and tugging, not really felt it, I just felt it with my head. I didn't feel pain. But then when it was time to do the bridges, he was like, oh, these are cemented. And so they had to start chipping away at them, kind of like knocking them out, sort of. And that was rough. That probably took the longest. And I should also say the first time I saw my teeth was when I walked into the emergency room, or not emergency room, when I walked into the surgery room and laid down in the chair before they started. I asked the dentist, can I see my teeth? Because I haven't yet. And he showed them to me in a little bag with like water that they were stored in, and showed them to me right there. And they looked, the gums did look a little dark to me at the time, but they also looked slightly translucent, so I wasn't sure if it was just the lighting. And I mean, I was getting it done, like, I wasn't gonna not have it done. So, you know, I saw them and they looked good to me. They looked like teeth. It's hard to say. You can't try them in until the teeth are out, until the implants are in. So, you know, you're going just by what they look like. So he's working on these teeth, and they're very difficult to come out. And then finally we're done with the top, and I think then he starts on the bottom. And the bottom, I was in and out of it, almost in a dream. I remember a few times I'd like come to and be in pain and start freaking out, and like my anxiety and panic, I had to just mentally really try to keep it together. And I also had a Xanax, a Vicodin, and a Benadryl prior, so that should have, you know, I think after a while it started helping me calm down, because then I had this dream almost that Little Dicky from the Chris Brown video came in the room and was holding my hand and laughing because I was squeezing it so hard. And I honestly don't know if that was a dream or if that was some nurse, a guy, like a nurse that looks kind of like Little Dicky. Like, I really don't know. But I was conscious, so it might have been a weird lucid dream, or like maybe it really was a person, but I never saw that person again, and I still have never seen them again, so that's just kind of funny. So then they're finally done with the extractions, and I remember just being like over it. By the time he said they were doing the implants, I was thinking, oh my god, like, I shouldn't feel this because I didn't feel the extractions. So I'm like, all right, just laying there taking it and trying to just listen to the music and hallucinate Chris Brown people, but I don't know. I was kind of in and out of it, and then I remembered waking up more and being more conscious and seeing my husband walk in the room. And by then, well, I think when Dr. Shatkins was done, he probably told me, good job, you did great, we're all done. And during the surgery, what helped the most was that he was just very patient, and he was not mean in the way that he would tell me to calm down. He was just firm and, you know, like, we have to get this done. And he was great. Like, he was very gentle, he was very patient. He didn't start working on me until I was completely numb, and I really appreciated it. He never yelled at me, he never made me feel like crap. He didn't make me cry, and I cried a lot during that surgery, and none of it was because of the doctor. And do you know how much of a miracle that is for me? Because so many dentists have made me cry just because I'm already in pain. It's nerve pain, dental pain. So when I would cry and they wouldn't stop working on you, or they just yell at you for crying and being upset that it freaking hurts, oh my god, it's just like one of the worst things ever. So I am very grateful to Dr. Shatkins for the way he dealt with me and my emotions and my anxiety. Like, I could not have done that surgery without him. He's truly got something special. That was why I trusted my instincts to have the surgery with him, and I have no regrets about it. So when he was done with everything, he left the room, and someone brought my husband, and I saw him walk ahead of the table where I was, and he went to sit down over next to me, kind of. And a nurse was like, I wasn't sure what they were doing because I was sort of in and out of it, but it was starting to hurt and I was starting to get aggravated. But it was really her taking the teeth with the teeth that snap on, and she was putting them on the implants and then having to take them back off to adjust them. And she kept taking them in and out, and I couldn't even get these out until the 12th day after surgery. So in surgery, I know that those were very freaking tight from the get-go, and they were hard to get in and out. So every time she would take it in and out, it was so painful and it freaking hurt, and I could tell she was like really having a rip on my jaw and then the uppers, and eventually they kept doing it and everything was wearing off faster and faster because by then we're almost done. They're just still taking them in and out, and then she said something like, okay, that's got to be good enough. She's going to have to wait and come back for adjustments, and then it was time to get up and go. And later on, my husband told me when he was in there, he was watching her do this, and she was having to make really major adjustments because my jaw wouldn't close, and she couldn't get them to go in there enough to get it to fully shut down the way it was supposed to. So big adjustments were being made, and it was very uncomfortable, and probably I feel like may have caused most of the swelling and pain afterwards. I feel like that was the most painful part, aside from the shots, was the end, taking them off the implants. But they're not always tight like that, but if you swell up a lot right after surgery, they can get really tight after. So anyway, they say we're done. I start walking out, and I'm, still coming to, like, trying to think, do I need to do anything? What am I supposed to be doing? Like, I don't even think I had a mirror at the time to look in the mirror at them, other than my phone. There was one point during surgery where they must have been doing a little break, or I was doing good, and they said, you want your phone? I said, sure, and they gave me my phone so I could snap a little during my surgery. That's in part of one of my other videos. So they were really cool. Like, they didn't mind that I was taking pictures and videos and all that. But I didn't really have any, there wasn't somebody that sat down to talk to me about the result immediately after surgery. They just said, okay, you're done. That's it. You go out the back door where the surgery patients go to get picked up. The whole way out, I'm telling my husband, though, that something's not right. I don't feel right. I feel like I can't shut my jaw all the way. Like, I really can't. The nurse was like, well, she's just not used to it. And my husband's like, okay, you're probably going to have to give it some time. You're swollen. You just got it done. So I'm like, I guess so. Like, I don't know. I feel like something's off here. And so we get out in the car, and then I was like, no, my jaw is not all the way shut, and I know it's not, and I'm going to call them right now and see if we can come back right now, because this is, like, really bothering me. So I called them, and they said, well, usually we don't have you come back till the 5th day, but we'll have you come back tomorrow. So I did, and I have videos all about what happened after surgery and the fit issues and everything. And, I mean, other than the fit issues, the surgery experience went amazingly. It could not have gone any better. I'm not the kind of person that's, like, brave with dentists that just wants to see what I can handle. So if I could do it awake and without sedation, I think a lot of people could. I think it just has a lot to do with the dentist and their knowledge of things, being aware of, like, the nitrous. If you're hyperventilating, you're probably not getting any. So you do want to make sure that you keep breathing through your nose as slow and steady as possible. And even though the novocaine shots hurt, make sure they just give you as many as they can. Like, don't tell them to stop. But that's about it for my surgery experience. I was very happy. I'm so glad it's done. I got 6 on the top, 6 implants. Oh, I should say how that felt. I didn't feel the implants getting drilled in. That's why I didn't really mention it. Didn't feel like anything at all. I mean, yeah, it couldn't have went any better. But I think that's about it for my surgery experience. You can watch the videos from after to see how I reacted to everything. It's a lot different later. It's been a couple months now, and I feel like I've gotten more used to my appearance, but I also feel like I still don't really love the bottom teeth. And I go back to my next appointment in about a week and a half, and we'll see if I get to talk about the new set, because they're going to remake these. They were off, and I think probably, I don't know what had the most to do with it, but they were made really quickly from consultation to the surgery day, and they're immediate, so you can't try them on before your teeth come out. So there can be some expected adjustments that are needed, and I'm glad that mine are wearable, but they're also gonna fix them. I'm very happy. But yeah, aside from that, everything went good. I think that's it. I might make another little video after this, because some people wanted to know how I clean my dentures, and it's pretty simple. So I might just make a really quick video telling you guys how I do it, and then I have another video planned for later when I get some new products. But for this video, that is it. I hope I didn't forget anything. I'm sorry if I was all over the place, but hopefully that will help prepare some people that are thinking about having immediates done. I had immediate snap-in acrylic overdentures on 10 mini dental implants, not sedated, all in one sitting, and it was great. And you guys can do it too. If you want something bad enough, you can do it, and it's very worth it. Just trust your instincts when it comes to picking the dentist, because that's got so much to do with it. But that's all, as much as I can think of right now. Thank you guys so much for watching, and please subscribe if you're new. I hope everyone has a fabulous day, and good luck with all your denture endeavors and everybody that's dealing with dental problems. I hope everyone has a good week. Thank you.